Hey, all. I wanted to share a few thoughts on the race and confounding factors, the maternal mortality questions of the homework. This is normally something we would discuss in class. There's lots of subtle points, and I just wanted to highlight a couple of issues. So let's get to my slides. So when we're talking about race as a medical issue, we have our exposure, race, white, black, Hispanic, whatever groups we're looking at, and we have some outcome we're concerned about, maternal mortality in these, prostate cancer, heart attacks, some long list of things. And there's certainly lots of other social issues which could be related to both the exposure and the outcome. Here's some that I've listed. Income. There's certainly relationships in the United States between income and race and income and health outcomes. Education, access to healthcare, pre-existing conditions such as, for example, diabetes, which is an important one in the maternal mortality story. And there are significant racial differences on diabetes rates in the United States. Air pollution is a serious health effect and is related to where you live. And which has racial relationship associations. Anyhow, I'm sure we could all come up with a bunch of things here. So there's all of these other issues. How should we think about them? From one perspective, I should get my face out of the way so you can actually see that. There we go. It makes sense to say these are part of the causal pathway. Why does race have an effect on health? It has an effect because we live in a society with significant racist underpinnings, and there are reasons why, historical, culture, I don't need to give you guys the list, why your race can lead to different levels of income, wealth, access to healthcare, all of those. And these issues certainly can lead to worse health outcomes. So thinking of it from that perspective, these are not confounding factors. They really are part of the causal pathway, and we should be looking at them as such. But that's not the whole story. We also might want to treat these as confounders so we can try to isolate the issues by which race works more directly. So we can argue that to some extent, the effect of race on health outcomes is mediated through income and education. That is, if you looked at the effect of education on maternal mortality, then essentially, and there's a lot of fancy statistics here, how much of the difference, the racial difference, can be explained by the educational difference? How much racial difference is left when you consider people of essentially the same level of education? That's the idea of stratifying. But if you could use a more sophisticated statistical techniques to deal with a number of these confounders at once, then that might let you isolate the elements that still aren't being explained by confounders, sort of the more direct effects of race, such as doctors and nurses failing to believe symptoms and concerns when reported by Black women as much as they do when they're being reported by white women. Or there's some really horrifying studies which shows that the medical system treats pain as though it's less severe when reported by Black people than by white people. So I wanted to highlight this because the question of confounders versus causal factors is really a simplification of a much bigger perspective, which is to think about all of the different ways that we can see effects on health outcomes and try to describe them as part of some very complex system. And a lot of the research into confounding factors has gone in that direction in relatively recent years. As if you're curious about this, there's a whole section in the confounding factors part of our textbook on directed graphs, which talks about this perspective.